Right.
Brian, do I need the mic for that? Okay. All right, I'm going to use my last one, and thanks for being here and braving the traffic. I know it sounds like it was horrible, and on both 71 and 75. Can you hear me? Okay. So we are trying something new with this provider forum, which is live streaming. So hello, the 3 people that are on right now. Welcome. And we're doing that based on feedback we got when we were making the calls to all providers to update information in our provider search. So we just want to have this opportunity so we can expand our capacity to reach folks. So again, if you are online and you have questions, you can type them in and we will get to them for the first time. So there might be some bumps. So we have a long agenda today with a lot of good folks coming. We're going to move it around just a little bit. People are going to be trickling in, and because Gina has something to go to. Start with the housing network updates. So Gina, you want to come up and talk? And then we'll move and have Stacy Collins talk about
those that we house or have some involvement, for the most part, with Hamilton County DDS. Hamilton County DDS is the referral for our homes. So if a provider has an individual that they would like to see added to a home, that would actually have to come through Hamilton County. You would have to work with the SSAs involved to have that come through. We do ask that providers are very flexible in allowing individuals to come and see those homes as individuals are trying to get placed into those homes. So a couple of the things that are new. So some of you, if you're a provider in a home, may be in a home that has a housing choice voucher. In the past, the way that that's worked is one individual in the home might have been lucky enough to have been pulled off the Section 8 wait list with CMHA and have a voucher, and all the individuals in that household were added to that voucher. So you may have Johnny, who is the voucher holder, and Sam and Paul might be other household members. They may all be on that same housing choice voucher as a family. Well, unfortunately or fortunately, the HUD field office has gone to CMHA and said, you're out of compliance. That is not a family the way that we think of a family. They each should have their own voucher for their bedroom and the shared living space. So right now, they're in the process of trying to convert all those to shared housing. So in a shared housing model, a unit's occupied by individuals that are not related, and each one of them is renting a bedroom in the common space. The nice part is each individual is going to have their own voucher. They can take those other places. The downside is administratively that's going to be a little bit of a nightmare. So we can flip. So from a provider's perspective, what you need to know is now Johnny will have his annual inspection. So will Paul and Adam or whoever I said the other person was. And each one of them is going to have their own recertification. So once a year you're gathering all this paperwork for the household, or you're working with a guardian or the payee for the individual to gather all that information. Now you're not gathering it once for everybody in the household. In April, you might be gathering it for one person. In May, you might be gathering it for another person. In October, you might be gathering it for the other person. And likewise, the inspections. And since it's the tenant's responsibility to be there for the inspection, which probably means the provider's having to be there for the inspection, it means that your staff might have to be there 3 times waiting for an inspector to show up instead of once. And then the other thing is making sure that all that recertification paperwork gets processed. Most of the time, well, every time, CMHA is mailing that paperwork to the home. So it's very important that your staff be aware that they need to be on the lookout for that mail coming. The other thing that you might want to know is, as they're transitioning our existing households, CMHA is working with LAD to get those individuals through that wait list process. So, I'm assuming everyone here is familiar with LAD. be on the lookout for any kind of communication that might come from CMHA or LAD if you have a home that has a housing choice voucher currently. The other change that's going on right now is we are making a change in how our smoke detectors are monitored. We've been working with one company and we're transitioning to Dial One. We're hoping that this is going to give a little less frustration in some of the pinch points that we've been experiencing. So we have so far transitioned 5 homes last week, 5 homes yesterday, and there'll be 5 homes a day all through next week. And then all of our homes will have been transitioned to Dial One. The nice thing with Dial One is their monitoring is here locally. So when you talk to somebody, it's not going to be someplace far off where they're trying to get a hold of someone locally. They're connected to the company that's selling us the services. The only other thing that you need to know is you're going to get an email, and in the email it's going to tell you when it's happening if you have a home that it's happening at. Just be aware that if you do have a fire in the day that it's transitioning, that you will have to call 911, that it will not call 911 for you. So for the day of the transition, from like midnight until it's converted, if something happens in that home and you need emergency services, call 911. So those are the 2 new things that are happening. Bed bugs aren't a new topic. However, it seems like we're having a resurgence of heavy infestations lately. So just a couple of reminders. We do require that our tenants report to us upon finding bed bugs in the home. We do require that the tenant receive 3 whole house treatments, and we do not go into those homes for a month after it's been cleared to do work unless there's an emergency. You know, if there's a flood or something, we're obviously going to be there, but routine work orders we won't be there for during the period until it's been cleared. The important thing with bed bugs is making sure that they're identified. We've talked in the past a little bit about different ways that you can identify them. Some of the best being putting 2-sided tape on beds, on the bottom of couches, and monitoring them. Usually you're not going to see a bug otherwise until it's way far gone. Looking at the mattress when the sheets are getting changed, looking for the casings, looking for blood splatter. Those are the important things. I do have a provider sheet that you could hang in your homes if you would like. It kind of gives you pictures, tells you what to do to try to monitor and prevent what's required from the housing network for in those homes. I have some of them here. I'll leave at the front. It's also on our website, and I'll show you that at the end as well. When you have an individual who's moving out, just be aware that they have to give a 30-day notice. When they move out, everything of theirs has to leave. So the bedroom has to be fully vacant. We can't leave behind furniture or other belongings in hopes that someone might need it in the future. Generally speaking, that doesn't happen. The room condition should be the same as when they moved in, less any wear and tear. And then we do a move-out inspection after they move out, and we disposition their security deposit. So that means if they have damages, we take it from their security deposit and send a check or a bill based on that afterwards. If they have a housing choice voucher, you have to report it to CMHA. If you don't report to CMHA, they may end up losing their voucher, and they'll need to have that mutual termination agreement with us in order to be able to keep that voucher moving forward. One of the areas that's been tough lately is just storage. There's a couple things. Our tenants are absolutely able to store materials in the homes that they rent from us, but we do ask a couple things. One is that the areas are kept neat and clean. They can't be in front of hot water heaters, furnaces, electrical panels, because I need to be able to get to those water shutoffs. And we're going to be making a change to the tenant orientation packet, asking that all of the materials that are stored have the owner's name on them. The reason is we end up sometimes being in a situation where we had 4 people in the home, so the last of the 4th person moves out, and they're stuck with everybody's materials in the basement to move out, and that's just not right for them. For work orders, all work orders need to be called into the main office. Everyone should have a magnet on the refrigerator with our phone number. If you do not have that, call me, we'll get one out to you. Call the regular number between 8 and 4, and you'll most likely have either Christina or Valerie answer the phone. You can also send a work order through email. I don't recommend it if it's something that has some urgency, but if it's a routine item, you need a light bulb replaced or something like that, by all means, you can send an email. Just know that you're always running the chance that someone may be out of the office the next day and not get to it if they're sick or something. If you have an emergency, and it's after hours, or if you have an emergency and no one answered the phone when you called and you left a message and it's been 30 minutes or an hour, call the on-call emergency number, the 328-1172. We will get someone out there, they'll answer the phone and either walk you through it or come out. What we consider emergencies are no heat or no air when the temperatures are high or low, no water, no electric, a fire, a flood, or there's no usable toileting. So that means if you have 2 toilets, one's working and the other one's not, then we wouldn't consider that necessarily an emergency unless maybe the one that's down is an accessible one and you need the accessibility pieces for the person in the home. When you're reporting a work order, if it's damaged, please let us know how the damage occurred. What we don't want to do is have Johnny had punched a hole in the wall, but Paul's the one who got billed for it. That doesn't seem fair. In the event that we don't have that information, the whole household gets billed. And there are times when, through accidents, a provider may cause a damage in the home. We don't want the individuals to bear that cost. So, the provider backed into a garage door or something like that. Just make sure you're also reporting them timely. We're in the homes once a month, but we're only in the homes once a month, and we don't want an existing condition to cause, a leak in the kitchen sink to cause a bunch of mold underneath the sink before we know about it. And when you're calling it in, make sure the people in the homes know, because sometimes we show up and they don't know why we're there. We do monthly inspections, as I mentioned. It's generally the last week of the month. We do send notices out. They go to the executive directors of each organization. We do ask that executive director make sure that they communicate that with the staff. It's actually in the email. We do need to be able to access different areas. We're out about once a week during the summer trying to mow. We've had instances where cars are parked so close to the house that we can't get around them to get them over to the backyard. We sometimes need to check things with the HVAC, replace a filter, or get to an electrical panel to fix an electrical issue, and we can't get to them. So it's just, again, really important that we are conscious about where we're storing things. Most of our homes have gas heat and gas water heat. Be really careful about where you're storing stuff relative to the pilot there as well for fire purposes. The number one complaint I generally get is from neighbors, and it's generally either about parking or grass. So this is one of our homes. We've had issues where individuals were parking, and honestly, you might not think of it unless you were the person who got stuck behind the bus picking up everyone for a day program while the 2 cars are there. So this is the only manner out of that neighborhood. We've had individuals who've been stuck behind a bus for 20 minutes while 2 or 3 individuals in a chair load, making them late for work, making them not happy when they call me. So just be really conscious with your staff about where they're parking. Sometimes people will park right behind a driveway for another individual, so parking here, then they're pulling out and struggling to get out of their driveway. Parking in front of a post box, and not being able to get their mail. So just as you're working with your staff in the home, talk to them about where to park. It is by far the hardest part, I think, for a lot of individuals, especially at shift changes. Also, I know sometimes, it's hard to get into a driveway or out of a driveway, but be conscious of rutting out the sides of the driveway. Some cars are starting to have damage because it's rutted so much from people driving off the edge. And don't park on the grass because we'll get cited, and if we get fined, we're going to pass that fine along. Trash is also an issue from time to time. Garbage cans themselves shouldn't be overflowing. but also if a fan's not working, or if you have an old bed frame or something. It's one thing for it to sit there for a week until you arrange for garbage pickup, but don't leave materials sit outside the homes for weeks on end. Because we've had some of these issues, we've seen a couple things happen. We've actually had one municipality come up and put up no parking signs. We've had a municipality issue a zoning code violation. They can ticket us. So just be aware of that. We do get feedback from municipalities when there's issues like these. And if we do receive a ticket, we'll be passing that back along to the provider in the home. The number one work order we get are for clogged drains. In part that's because of the population we serve. In part it's because housing stock in Hamilton County is a little bit older. But the biggest thing is please do not put flushable wipes down any drain of ours. I know some of them say flushable on them. They are not flushable. They do not degrade, and they do clog the line. If we pull them back, then we have to build back. We've also had paper towels, other things go down the drains. Just make sure your staff know the only thing that can go down a drain is toilet paper. And if you're lucky enough to be in the one home in Hamilton County that has a septic system, septic safe toilet paper. HVAC is another area, especially after the hot weekend we just had. We've had a couple providers that are trying to save money for the guys, which is great, but turning off the AC or the heat during the day to try to save money actually is costing more because it's taking a lot more to bring it back up to temp. Don't set the AC lower than 72 because it could freeze up, and at that point you're going to call and say we don't have any AC and there's nothing we can do until the whole thing thaws. So it'll be warm at least for a day while we're trying to get everything thawed and start back up again. Don't leave windows and doors open with the HVAC running, and then realize that storm doors aren't efficient barriers for heat transfer. Trash day has been a problem in some cases. Sometimes staff in the home, maybe a new staff, don't realize what day trash day is. Posting the day of trash day would be much appreciated from our perspective. Sometimes that ends up either with the trash overflowing or complaints from the neighbors because the trash hasn't gone out. I know I kind of talked quickly because I know you have a long agenda today. Everyone here, if you are a provider in our home, should have access to the tenant orientation booklet. If you don't, please email me. I'll be happy to share that with you. I do have some bed bug guide sheets, and I'll show you in a minute on our website where you can get more. And then my phone number and email address are on the last screen here. I have some cards if anyone has any specific questions about a home that they're in. Always feel free to contact myself. Valerie in the pink is one of the individuals in the office who will answer the phone if you call our main office, as will Christina Zillick, which if you're in our homes you may have already met. And then lastly, our website is housing-network.org. And when you go out there, there's a tab that says Tenant Resources. Under the Tenant Resources, there's a link here to the bed bug provider sheet. And that'll get you to the same copy as this, in case you want a copy to hang in some of your homes. Did you want to add anything before I ask if there's questions?
Thanks, Gina. I forgot new technology. Sorry, Ryan. Okay, sorry I wasn't here to introduce Gina and get us started, but I just had a couple things I wanted to go over. How many of you providers do provide services in a housing network home currently? Okay, so pretty good number. So most of you I know have been around for a while and understand how the housing network works, but for anyone who doesn't, I just want to make sure that everyone understands, first and foremost, that the housing network is the best landlord you're going to find out there. Through our contract and through the housing they've been able to secure through DD dollars, they are able to provide the most affordable housing you're going to find anywhere in the community. They are a reliable landlord, unlike many that we run into when we get out in other places in the community. And I know that, Gina, you spent a time talking about vouchers and how important they are. And that's critically important for our folks, especially in these days. I know our housing team struggles with this every day. We have a really hard time finding safe, affordable housing, particularly if it needs to be accessible. So anytime we're serving someone who's living in a network home, it's just really critical as a provider that you help us make sure that everything's running smoothly, particularly with those vouchers and those inspections. Really, really critical. Speaking of our housing team, I don't know, I think many of you know them, but could everyone on the housing team just sort of wave your hands over there? We have 3 people on our very, very big and powerful housing team. Dave oversees the team, and mainly Dave's role is a lot with contracts, and particularly room and board contracts. Debbie's the coordinator and oversees many of our housing projects and matching people, and we have so much work that we brought on Tennille as our housing SSA, and we're really glad to have her on the team too, and she's also helping with all the work Debbie's doing and doing a lot of matching and helping people find places in the community, which is really tough. One other thing, just wanted to remind, and I think I'm talking to the wrong group here, if you could all just remind your staff that these homes are the individuals' homes. They're paying for it, it is their home, it is not the agency's place, it's not the agency's home. The housing network is the landlord, but it is the individual's home. We just need to really make sure we emphasize that with our direct staff. The other thing I just asked for your help with again, if you could spread the word to your staff back at, in the homes. Really cooperation with us trying to find good matches for people to fill when there is an opening in a home is really critical. It can make or break a good match, and it's really important that we partner together on that. When we have vacancies in those homes, because of the way that we partner with the network and our contract with them, it costs the county money when we have vacancies. So we don't like to see that, and for some of the folks in our homes, it also makes costs of other things go up, and so if we're sharing something 3 ways versus 4, the cost is going to be higher. So we always want to make sure we can get it as affordable as we can for folks. I think that's all related to this that I wanted to cover. Dave, did I miss anything we talked about, Debbie? Tennille? No? If you have any questions about housing with the network or outside, make sure you reach out to our housing team. One last thing that's not on the agenda, I just want to say it because we're having a lot of issues. If you serve someone who you know has lost their Medicaid, whether we're the authorized rep or not, please reach out to us to assist you. We are having providers wait 4 and 5 months. They've been getting rejections on billing, and the rejection code is loss of Medicaid, and no one's reporting it to us for 4 or 5 months, then asking us to help. The further out we go from that loss of Medicaid, the less likely we are to help. We're trying our very best, but we're seeing a lot of problems that are not an error on the part of the person served or the rep. Sometimes we can help get them fixed, sometimes we can't, but the earlier we try to address it, the better. So if you're seeing that, Antonio Atkins is our benefits coordinator, and I will make sure, Karen, I'll give you his contact info to send out with the information following this meeting. Even if we're not the rep, we're willing to help as best we can. So please let us know as early as possible if you know someone's lost their Medicaid. And if we're the rep, don't assume we know about it because we're not getting notified. So we have lots of mail that's not coming to us. We're not finding out until the provider tells us there's a billing issue. That's how we're learning about things, okay? So as much as you can help us, that would be much appreciated. Okay? Thanks for letting me still squeeze in, guys.
Thank you. Okay, so next we have Stacy Collins, who's from DODD, and she made the long trek with the horrible traffic to come and talk about employment and vocab. And we have a recent memo that has come out, and I know that you may have questions, but she's going to provide some clarification. Thank you, Stacy.
Yeah, thank you.
No,
Absolutely. I'll be careful. So good morning, everyone. Glad to be here with you. I want to thank Hamilton County Board for inviting me here today. Keith Banner would typically be here, but he's actually out of town. So as Dawn said, I'm with the Ohio Department of Developmental Disabilities. I work in the Division of Policy and Strategic Direction, and I lead our Employment First initiative and our Community Life Engagement initiative for Ohio. So I'm honored to be here to talk with you about adult and employment services and kind of what's going on in that area, to give an update. I'm hoping most of you have had the opportunity to talk with and engage with Keith Banner. So Keith Banner is our Employment Community Life Engagement Project Manager that's located here in Southwest Ohio. So if you haven't had an opportunity to meet with him, please take the opportunity to do so and reach out to him and talk with him. So in regards to just an update around Adult Day and Employment Services, I really just want to take a few minutes is not just to dive immediately into the notice that came out in August, but just to talk a little bit about our work quickly over the last several years and how it ended up in that memo and kind of where we are today. Who currently in the room, honestly, is providing either an adult day or an employment service? If you can raise your hand. Okay, thank you, that's helpful. So our Employment First initiative and our work started actually back in 2011. So we have been working over the last 7 years on really making sure as a state we're prioritizing community employment and options for individuals that we serve. So we've done a lot of things. Our initiative has actually grown to also cover what we call community life engagement. So what I mean by that is, how as a system are we making sure in Ohio that we have working age individuals with intellectual and developmental disabilities working, but also that we have a system that's flexible to them when they want to do things outside of work, when they don't want to work, maybe when their health's not allowing them to work, and so that it's flexible to them when those situations arise, and that we have a system that's prioritizing community employment, of course, person-centered planning first, right? Person-centered planning, community employment, as well as community membership. We've done a lot of things. We're going to continue to do a lot of things, but we really have been working on how are we having a system that's doing that, that's prioritizing those three things, as well as a system that understands when we are a Medicaid state. So when we take Medicaid and federal funding, we have regulations that we have to follow. And so how are we aligning and making sure as a state we're in alignment with those regulations, right? That is a requirement of us. And so how are we doing that? So we, over the last 7 years, have been working on multiple different things. One of the things that has led us to where we are today is we've been looking at our services. What services do we have available in Ohio that allow an individual to work, live, and participate in their communities? And we went through what's called funding redesign. We started that work back in 2014 and really worked on, if we are talking about our vision, right? Working age people working, a system that's flexible when they want to, when they don't want to, when they can't, that prioritizes those three things. What services do we have? What does that look like? And so it all ended up in what we did, service updates. There was one update that was effective October of 2016, which was the vocational habilitation, that combo code. That combo code was no longer available in October of 16, and then it moved into some changes. April of 17, we made sure it was clear what the actual services, what they were about. Each service, there's an expected service outcome, as well as a new service called career planning came up. Okay, so our vocational habilitation, our adult day support service had the outcomes were listed in there. We additionally renamed Enclave into group employment supports. Supported employment community at the time moved into two services, career planning and individual employment supports. We did extensive training and planning leading up to April of 17. We continue to do extensive training today about those changes within those service rules. All during those trainings, there was continued questions about what is the service and what isn't, right? What is it? What isn't it? What can we do in that service? What can't we do in those services? How can we pay individuals? Can we pay individuals in those services? Can we not? If so, what does it look like? So, I'm hoping you guys are feeling lots of questions were coming our way as we went and did those changes in April of 17. What we understood is that there was many questions that we weren't able to answer on our own, meaning there was going to be, if we answered the question, big impact into our system, big impact on our individuals and providers. And so we wanted to collectively make these decisions and answer these questions together, because when you have regulations, there is flexibility in those regulations. You might not believe me, but there's like a flexibility in those and how you interpret them and how as a state you're going to work through them. So we decided to bring together what was called the Payment in Adult Day and Employment Services, because a lot of the questions stemmed around how do we pay people? What is okay in how we pay people in adult day and employment services? And so we got that group together actually in September of 2017 because the questions continued to come in. We knew that we had to provide some clarification across the state to what this could look like. So that work group came together in September. The first thing that we did is we did what I call getting a state of the state, okay? We weren't going to dive right into all these questions before we actually knew what were the different ways in Ohio that individuals were being paid in Medicaid services. And so our first session was all about the state of the state. Tell us. So we had work group members attend. There was representatives from all the associations we typically work with at the state level. So our Ohio Association of County Boards were represented, Ohio Association of Adult Services, the Privatization Support Group, Ohio Waiver Network, OPRA, so the Ohio Provider Resource Association. If I didn't say that, if I said it twice, sorry. We had OSDA, so the Ohio Self-Determination Association, ARC of Ohio attend, and we had other providers from across the state attend. So our group was right around, don't quote me, but around 12 people. And we asked everybody to come to that first meeting and tell us, what are the ways you either are paying people or you know that your colleagues are paying people across the state? We organized all that information. It took us a good 5 hours to talk through all the different ways that people were getting paid in adult day or employment services in Ohio. And we organized it all into 9 categories. We were able to take all of that, synthesize it into 9 categories, and we just told the work group, okay, we're going to take all that information, we need to take it back into DODD, and we need to take a look at it and see and kind of categorize it even more. What are things that are currently happening that really regulation says shouldn't be happening and we need to address it, versus areas that really there is no regulation, it's kind of a gray, but it doesn't feel okay. You know, kind of you're like, in my gut, I'm not sure that's okay. So we need to dig a little bit deeper. And then a category where it's, really there is no regulation, there is no guidance that says otherwise, and really we feel it's an okay payment practice. So we took all that information and then we organized it and brought it back to the work group in April of 18 and said, and after we categorized those 9 areas, we told them that there was 3 that as a state we needed to address, okay, right off the bat. Those were the categories, I'm going to call them, they were called gifts and incentives were the first one. We feel the regulation is clear in regards to inducement into Medicaid services. So what if something's enticing somebody to come to Medicaid services and a certain provider, we had to deal with that. So some of the examples we got, it was clear that those were inducements into Medicaid services, again, broadly speaking, and so that we wanted to, and we had to give some reminders and training about gifts and incentives. The second area was what we call conditional pay, was an area that was addressed, that was shared in that meeting. Conditional pay is basically you come to me for services and I'll make sure that you get paid, but you have to get this service to get that payment if it makes sense. And so what was shared during that work group meeting in particular is transportation. If you choose us for day and employment services and you choose us for transportation, we will make sure you get paid when you're actually in our services. So it was conditional in nature, okay? If you did these things, then you can then receive the outcome of payment. Then the third issue was what we call guaranteed pay. That meaning no matter what services you're getting, no matter if there's work or not work, you're guaranteed pay just to be there, okay? So it related a lot to that daily stipend. So if you come to us, if you're getting our services, work or no work, you're going to always get $15 a day. That is not okay. So that work group worked through that back in April. Hopefully I get my dates all right. In April, talked through those 3 issues. Another issue which we discussed was what's called Medicaid pass-through. Medicaid pass-through is a concern that came up during that work group meeting where providers were Medicaid providers. They were providing a Medicaid service to Medicaid recipients, okay, so the individual receiving that Medicaid service. And actually, what was paying the individual, so that provider was paying the individual, was actually Medicaid funds. So there wasn't any contracts or jobs with any businesses. What was happening is the Medicaid dollars, the provider was authorized to do a service, was doing their service, and then the money was funneling straight to the individual. That came up a lot of how, is it okay? Is it okay as a state if that's happening? Is it not? Is it, what does that look like? So that was a big topic in April as well. We decided as a work group, and we took the feedback that we got, that we needed to address those 3 categories I talked about before: gifts and incentives, the guaranteed pay and conditional pay. And it was decided that we would do so in a training notice and that in our guidance memo, and so that came out in June, okay? What we agreed about at that time is we didn't know enough about Medicaid pass-through to even really say much, and that if we did and our work group members gave us feedback, now's not the time. Honestly, we need to continue to work on it, make sure we had examples of it, what it would look like, an enforcement of that, because that is not something right now when we talk about largely that we're doing. So we tabled the Medicaid pass-through discussion, and we agreed to work with our 2 big partners, OACB and AHPRA, on putting language around that, right? What does that Medicaid pass-through look like? Is it okay? If not, what is like the examples of it? So first notice went out. I've got my team who's across the state. Again, Keith's in your area, who is available to talk about that memo, to talk about your organization and your structure. So we have technical assistance that's available across the state. We then decided, again, to meet with our partners, OACB and AHPRA, to work through this Medicaid pass-through. So in order to really get to this, how are individuals being paid in Ohio? Is it okay? We had to dig through federal regs, okay? For us to look at that regulation collectively together, we had to dig. We had to review, what does it say? All of our groups of people were talking to each other, right? Attorneys to attorneys, us and me, and kind of everybody was having that dialogue. Through that actual combing through the regulation, what came up pretty quickly is the 50% requirement in vocational habilitation. Okay, so when we were digging through that reg, came up pretty clear, oh, there's a part of this that we didn't know, it's a big issue in Ohio. So quickly in our conversations with OACB and AHPRA, the 50% requirement bumped up to the top over Medicaid pass-through. So in our conversations with them, it was really what is the impact in Ohio? What does this look like? What do we need to do? So let me first tell you what the regulation is, for any of you who don't have the notice. Is the 50% regulation in Ohio, our services are named a little bit differently than how actual CMS categorizes it. Okay, so stay with me a minute. So the vocational habilitation service, as we call it in Ohio, to CMS is actually, so the Centers for Medicare and Medicaid are actually called a pre-vocational service. If you guys, any of you attended any of my trainings or Keith's trainings over the last several years, we talk about pre-vocational a lot. Our services are pre-vocational in nature, okay? And so when we looked at the actual pre-vocational requirements, under that it indicated that someone in a pre-vocational service could only be paid 50% of minimum wage. Okay, what that means is that someone in that service who's getting paid over $3.63 an hour is actually not in compliance with the federal regulation because they require that payment restriction. Okay, and we interpreted it to be federal regs. So that's, I'm taking the federal minimum wage, that's the $3.63. After looking at that, we decided, okay, there is how do you even calculate it, first off, right? The reg says 50% of minimum wage, but it doesn't say how you calculate it, what that means. We know we have a variety of ways that individuals in Ohio are being paid in services, and so we knew immediately that we needed to get our group back together, our Payment and Adult Day and Employment Services work group, to really dig into this reg quickly to see what it says. We did, as a state, information did get shared prior to us actually having our full plan in place of what this needed to look like, but we were getting a lot of questions. So around the end of July, early August, we were getting a lot of questions about this requirement and what it means, because we are a state that has a lot of people sitting in that vocational habilitation service, getting that service, and who in fact are getting paid. Because of the questions, we felt we had to get information out, okay? We were getting questions and emails, information was actually incorrect. And so that's why we sent out the notice in early August, and that's why I'm here in front of you today. So if you are a vocational habilitation provider, I hope that you have seen the information, okay? If you haven't, it is available for you on the DODD site, but I think the easiest way to work through it is to actually get a hold of Keith and have him come out and meet with you. He can go over that notice. Again, he should be calling you. If he hasn't already called you, he will be calling you. And so basically the notice indicates is that the regulation is there, okay? That we're reconvening the work group because there are a lot of questions. I'm standing here in front of you. There are a lot of questions that we don't have the answers for, okay? And so because of that, we don't want you acting quickly without assessing the impact to your organization and without planning what you want to do. And so the notice gives you reference to the actual federal reg. Should you be interested in wanting to see it, I encourage you to take a look. It talks to you about the work group. We actually had our first work group meeting on Friday. We're kind of reconvening with this larger scope on Friday. We have asked for a commitment for a year for these work group members to meet with us every month to work through the questions in these timelines within our system. We also are going to be contacting all agencies in Ohio who are providing or have billed a vocational habilitation service. So we looked at billing for the last 18 months, and we have almost 300 providers across Ohio who've billed vocational habilitation. Either I or my team will be calling everyone by October 5th and making sure, one, you've got the information, two, that you understand it, three, that you really take the time to assess and plan, okay? Because we don't want very quickly, oh my gosh, I'm gonna rush into this and I'm gonna change all of this over for the individuals I serve in the organization, because I think that we can do this in a planful way. So assess impact and plan. Hold on one second. We have called, we've got about 7 agencies left. So we did pull out the top 29 agencies just because of billing. And we've given, I think, 24 out of 29 calls. They will have their calls by Friday if they don't have them already. And then everyone else by October 5th. And then we were going to be posting, so the work group, we want to be as transparent as we possibly can to what's being discussed in that work group, what decisions are being made. And so every week, within the week of the meeting, I will have posted the agenda, the meeting minutes, the PowerPoint presentations, the supporting documentation. All of it will be available to you. For ease of getting it up and getting it up quickly, it will live on the Ohio Employment First website. So that's ohioemploymentfirst.org. And where you will find it is right when you go to the home page on the very front. It's called Vision and Strategy. Okay? It's a tab. It says Vision and Strategy. You click on that, you will see vision, mission, priorities. We have set out goals for ourselves. When we went and did this work back in 2014, we heard very loud and clear that we had to build a bridge from current services in 14 to future services, and that we had to do it in phases. And so we put goals in place for phase 1, which to us was 2011 to 2015. Phase 2 was 2016 to 2020. And then phase 3 is 2021 to 2024. All of that's sitting there as right now so that you can see what those goals and targets are. And then you're going to see the 2018 work group, and that'll all sit there. So you should have the first wave of work group information uploaded by the end of Friday so that you can see it. You go ahead. I've got more, but you had your hand up.
Yes. The question about how, what might the impact be, that's been asked of our agency a couple times now. And the reply I always have is, well, can you give me further definition of what are we talking? Are we talking an average? Is it a monthly average? Is it quarterly, a 6 month? What are we, or is it, this person worked on this job for 10 minutes and earned over 50%? To be able to relay an impact providers need that definition of how we're defining that rate.
So the question was, for those of you, I don't know if you heard online, was really in order to assess impact as an agency, we've got to know how to answer that. How do you calculate the 50% wage requirement in reg? And so until we have that definition, it actually makes it very difficult. We know that, absolutely. So by Friday, you guys will see, we actually put a, what we call the work group charge together. So we set for ourselves quarterly targets that the work group has to accomplish. And then in order to get that accomplishment, we have monthly things that we have to do. And one of the first things is we have to decide, how are we going to enforce? So how would you calculate that 50% wage requirement? So that is something that has been set aside for that first quarter. But what we've been asked to do by the work group is, let's evaluate other states. So we've already done a preliminary assessment of impact. So we have our billing data. So any provider who's billed vocational habilitation, I've pulled that. So I know that we've got 298 providers who've billed vocational habilitation. We then did a comparison to our outcome tracking system. So any of you in the area that provide that any employment service knows that we have to, and you have to, report out wage and hour data, right? So anybody getting an employment service, you've got to report in the outcome tracking system how individuals, are they in sheltered work, are they in community employment? If they're in community employment, are they enclave, are they self-employed? Then you tell us wage and hours. So we then did a comparison to the actual individuals who've been entered into the outcome tracking system. There is some difficulties with it in regards to how you report wages to get a preliminary impact, and so that will be in the slides that you see on Friday. We are estimating close to over a 50% impact within our state, individuals who are receiving vocational habilitation. It's ranging anywhere between 47 to 52% of individuals receiving services. So you'll have all that data. And just to get to the question is, that's one of the first things that we need to do within that actual first quarter. And what I was going to say is that the work group is asking us to evaluate other states, okay? And how are other states who have a similar pre-vocational service, are they doing anything about it? If not, let us know that. If they are, what are they doing? And really the question is, how do you enforce something like this? We typically, when Office of Provider Standards and Review comes out, we do not talk about deeply wages, hours, organizations' financials, and things like that. So how would this look, what would this look like? So great question, we need to get there. The 6 states, so we are looking at 6 different states. The work group will be analyzing that information over the next 2 weeks. I've done a preliminary review of New York, Pennsylvania, New Jersey, Wisconsin, Missouri, Iowa. Is that 6? So,
1, 2, 3, 4, 5.
So
New York,
New York,
Pennsylvania, New Jersey, Wisconsin, I can't get the last one. Iowa.
in Missouri. Yes. So the goal of all of this is, again, I want you to know there are lots of questions that still need to be answered. And our goal is that as we answer them, we will share it, we will do trainings, we will do technical assistance. All of this, I do feel, though, not only is going to address this 50%, we have to continue to talk about the big picture within our system of adult day and employment services and our goals and targets that we'd set for ourselves in 2024. So please keep an eye on that site. And again, please keep Keith close if you don't already. Yes?
Another question, for those of us that our agencies use Work Succeed, many of us also, we offer work opportunities, specifically those that are very community-based. It can't be time study. So just to be in good stead with DOL, we pay minimum wage. Is there any opportunity to dialogue with the feds on getting some carve-out situations against this rule? Is that part of what your committee's gonna look at doing? Because if not, I mean, you're gonna see a real flattening of service offerings, I think.
So we definitely, the question, again, for those of you in the room who didn't hear or are online, the question was, within our work group, and Steve, tell me if I'm wrong, within the work group itself, is there going to be some discussion and evaluation of engaging with Department of Labor or CMS? Yes,
To look
am I
for-
summarizing it?
Yes, to look for carve-outs that are beneficial from a rehabilitation standpoint, versus just offering bench-type work.
Yeah. So the best way that I can summarize it, it's going to have to be part of the conversation. So when my team has calls with providers across the state, we're summarizing that information and actually reporting it back to the work group as questions, concerns, things coming up from the field. And so when I met with the work group on Friday, we had 68 calls done by that point in time. Your organization was one of them. And so we organized all of that information and brought it to the work group and said, here is what the field is saying. Here's the questions that we have to dialogue on and answer and think about what our approach is going to be. The biggest one was, how do I calculate this? What does that look like? The second concern was around, how do I do this when I'm a provider, but I'm also an employer? And when I sit in that dual role of an employer and a provider, I have Department of Labor on one side, I have IRS, I have CMS on the provider side, I have the Public Utilities Commission, I have all these different organizations, but especially when I'm that provider and that employer, I have DOL and I have CMS that I have to answer to, and they conflict each other, right? And so how do I do this? What does that look like? So that is going to have to be a conversation and a discussion in regards to, are we going to reach out and ask for a carve out or a kind of waiver or an adjustment? I think it's too soon within that work group's discussion to say that, but that has come up. I shared that on Friday, that when you are doing both, the complexity of the role in which you're sitting, I understand. I mean, I've sat in that role before. It's really, really hard. Other things that the work group, our calls have told us is that the concern for impact of person. So in all of this, I want you guys to know we absolutely are acknowledging the impact on person. We all know the value of work, right? What unites us is we all understand the value of work, whether that's in competitive integrated employment, whether that's employment through a service. That was the one thing that it was clear on Friday that unites us, is that value of work and the impact of person. And so that is why the work group's in place. That's why we're going to be communicating with you on a regular basis on what this means, what it looks like. Additionally, I don't know about you guys, impact to provider obviously was huge. Impact to individuals and families, and how do we communicate this, especially when this has been my job for however many years. And now you're saying that this can't be my job, okay? So we are working, Steve Beha in our department, and we've already met with OPRA and OACB, are working on a family outreach and communication plan. You'll see that from our meeting on Friday, and you'll see our targets when we'll have communication going out. We're targeting our first bit of communication for October, so that you will have that. The goal is that you will be able to have the information, use the information, share the information. Again, my team's available. If you need to have hard conversations, county board or provider, we will be there to have those hard conversations. You just need to reach out to us. And we will have that. Another big piece that I want to call out that we heard loud and clear is our providers are tired. Fatigue is huge at this very moment for our providers in our system for many, many reasons. And so that was shared as well, of how largely and how loudly that fatigue is coming out. So I don't have a lot of answers. I have plans and goals set and targets. Again, it's about communicating with you. you communicating with us, I mean, please, I know Keith's not here, he would be here if he wasn't out of town. Use him, talk to him, call him, and if he needs my assistance, he'll call me in as well. Anything I'm missing? Any questions that you have? I appreciate your time so much for being here. So I didn't have a PowerPoint. I just wanted to talk to you guys. So have a good rest of your week.
Well, thank you for being here. We sure appreciate it. And I know Melissa Morelli from Active Day is on that work group, so she's willing to come alongside Keith to do regular updates because it sounds like we're going to be, that work group is going to be active and be answering questions as we go. So we'll stay tuned to that. And also we'll provide a link to the website site that you were telling us about. So thanks for that. Next we have Jamie is going to give us an update on EVV.
Sure. Do I have to go up there?
You do, you have to stand, you're not, he's the one that's not supposed to wave his hand. He's to stand in one place and not
Okay.
one of me.
All right. Hello, everybody. This will be real short. So if you remember the last couple of times I've been telling you, EVV is coming, electronic visit verification, and that we have tried to, I can't stand in one place. And I've tried to let you know about that we've had different efforts to try to delay on the federal level. We were successful on the federal level through Anchor, which is our federal provider association. However, the state of Ohio, Medicaid, has decided that they're going to go ahead and continue. So phase one included a lot of EVV, included home health care, a lot of traditional nursing services, those kind of things. Phase two includes us in the DD system. So I'll make sure I get this right.
We can't hear you.
I know it's off, I think. It's dead.
It's not good. Put it one place. Straight
Oh my God, all these rules. Jeff. All right, so the way it's supposed to start is phase two is supposed to start in May of 2019. The next big group, there's lots of groups on EVV that are around there. I have a private group of providers that are trying to impact the bigger state group. There's another group that's trying to impact our little group. There's groups everywhere. EVV will be effective in DD services in May. Make sure if you're not familiar with the service at all, which I know a lot of people won't or aren't, make sure you do. If you're an opera member, of course, you're going to get a lot of information from us. If you're not an opera member, I understand Karen's going to become an expert in EVV.
I'm doing my best.
Yes, with Hamilton County. So we're all here to help each other through this, okay? We're going to try to figure it out. Yeah.
Can you just give an overview of phase two?
Oh man, I am not the expert in this. Karen's the expert. Phase two, basically what EVV is that we're going to have to, be accountable to the Department of Medicaid when we're providing services, okay? So when we provide services now, typically in residential, if you're an independent or an agency provider or whatever, you have a billing mechanism that you use to bill for those services, right? This is almost another layer.
But phase two is residential, right?
Yes.
That's really where I wanted to.
Oh, okay. Well, see, you should have just told us. Yes, phase two is residential. Yeah, in shared settings, right? Not shared settings. Not group.
Non-shared settings.
Not group homes, those kind of things. It's support living, independent providers, nursing services.
Yes.
Yep. So all I want to tell you is if you provide those kind of services, start paying attention, find the information. There is a work group that the department's putting on, and the Department of Medicaid, and it's open to anybody. That'll be September 19th at 2 p.m. It's going to be at the Developmental Center, I believe. 1601 West Broad Street Training Room in Columbus. Everybody's willing to, and welcome to attend, I believe. This is a big deal, folks. It's going to affect your business. It's going to affect your services to people. So you need to get on board. It's going to happen. So that's all. Oh, thank you. Thank you.
All right, thanks, Jamie. So the next three things that we're going to talk about are really our local response to what we know is the DSP crisis. So these are things that we're working on locally to begin to support DSPs or continue to support DSPs. And the first really is Tim Cordroy is going to come up, and he is one of our SSAs, and he led a poverty simulation for SSAs and for some of our providers. So I just wanted him to talk a little bit about that, because that's part of a constellation of things that we can begin to do to grow awareness among our managers about how we support folks we support, and also DSPs that may be wrestling with financial issues.
Thank you. We'll try and get this, maybe not
Just hold it close to your mouth.
very close.
Yes.
Yeah.
All right. So, as Don said, I am Tim Cordray. I'm an SSA here on the dog community. And last month we transformed Kingsley here for a poverty simulation. It was called A Day in the Life of. And the poverty simulation was created to, kind of give some frustration. So there were short days and people were required to work and pay bills, and there were some evictions that I know that some of our volunteers were more than happy to do. But overall, it created a sense of empathy for the individuals we serve and what they go through on a daily basis, trying to get everything done with or without help. So it was mentioned by some of the providers that went through the simulation that it may be a good thing to continue this on a larger scale for you guys, more providers, to get your people in to help them, maybe see a little bit more on the empathy side for our individuals. So I look forward to working with you, and I'll be hanging around if you have any questions. Thank you.
And Tim, just to kind of piggyback off that, all the full standard providers were there. Absolutely amazing. It was, I'm not so dramatic, I'd say it was life-changing, but it really just gave you a different perspective. So I know on Friday, the gold standard providers are going to be talking about this in some space that will come to the meeting to see if we can do it on a broader scale, to have all providers who are wanting to come be able to go set a site and try to make it happen. But it was amazing. So great job to you, because it was truly, what you wanted to have happen is exactly what happened. So
Absolutely, yes.
Thanks, Tim, and he really did do a wonderful job, and so he has all the materials prepared, so it would make it very easy if we wanted to expand this to our provider community, if you wanted to participate. And again, there's a debrief afterwards where, what did we learn? And one of the things, again, we want to remember is that, many DSPs are managing multiple jobs, may have car problems. We want to remember that this might apply broadly. And so it'd be something, if we are able to, as organizations, become more informed, we can better support our DSPs as well. So, okay, and so now we are on to Mark is going to talk about Bridges to Equality. There you go. I have to stand right here.
I got Jim.
Yeah, stand still, man.
Order, stand straight. Hi, my name's Mark, and I'm here briefly, and I know we're running a little behind. I'll do as quick as I can. I want to talk a little bit about Bridge to Equality. It's an event coming up September 27th from 11 to 2 at the State House. I want to give you a little bit of an overview. If I said right now, across Ohio, we know that we're fully staffed, we have an abundance of staff, and every individual with a disability has free choice to do their activities, to go places they want, because they have the staff they need to make those informed choices. Everybody in here is saying, no way. You know what's wrong. Individually, we all talk about the same problem. You talk about your coworkers, you talk about your boss, you talk about your peers, your friends, your family. The staffing crisis is real. Individually, we all talk about it. Collectively, we've not done a thing about it. Collectively, okay? In my 30 years, this is the worst it's been, as far as my concern, We've not had a unified voice to talk about the thing that matters the most in everything we do each day. We can talk about rules, we can talk about regulations, we can talk about everything we're doing to help support individuals with developmental disabilities. But the reality is the DSP that provides that direct service face-to-face with the individuals we serve in Ohio is what matters. And we're not doing enough. So today I'll talk a little bit about the Bridge to Equality. It's the first time in 30 years that I believe we have unified support across Ohio. I've never seen such collective support from the County Board Association, Superintendent's Association. We've seen support from ARC Ohio, Disability Council, Waiver Ohio Network. I can go on and on and on across that everybody's nodding their head saying, we got to fix this problem. So we've come up with, we don't have to, do we? I'm right at that point where I turn and talk about this. So everybody, you have a cards in front of you? Can you pass this out, John? We can go over that a little bit. There's a logo on the card that's coming around. You can see it. And it's basically, it's Bridge to Equality. And this is building resources for individuals with with disabilities to gain equality. Obviously, the bridge to equality, what is the gap we're missing? It's the DSP. We've got to fill that gap. And so as soon as you see the logo come up, you understand. The reality is that intentionally, if you look at the logo, there's a color code on there. It's rust. It's an orangish color. We're saying there's two things here. We've got a huge gap to fill the need for individuals with developmental disabilities to do what they want to do. And then secondary, the current workforce is worn out, it's tired, and it needs obviously fixed. And that's the rust aspect of the bridge itself. It's collapsing around us, and we've got to fix that foundation. So the bridge, I'll keep moving up. The gap basically says, a couple quick stats. The 2017 DSP rate is 61%, okay? That's up 10% in 2015. Central region in Ohio was at 81% DSP turnover rate. If you haven't had time to look at the report to the president, report that came out, I've never seen such an accurate, detailed report that went to the President of the United States talking about a nationwide concern around the DSP shortages and what impact it has provided individuals about lack of choice, lack of options in their lives. People with a developmental disability cannot, should not, because of their disability, have a lack of choice and option in their life. And that's really it. They were born with a disability, and therefore, they have a lack of options. The federal government needs to step up and provide that option for those individuals, and it's all around funding. We know that. The high overtime burnout, upper management, it costs to replace, now we said $2,413 up to $5,000. That's reported by Anchor, a national association. Low wages, the national average is $11.76 an hour. Half the DSPs today are on food stamps and they receive some sort of assistance from the federal government just to work. 1 in 5 are in poverty, and we understand there's a work-life imbalance. If you talk to any DSP, they're going to tell you, I quit my job because why? I love my clients, I love what I do, I can't afford it anymore, and it's killing my lifetime with my family. I'm not seeing my family. We have higher, excuse me, I'm going to keep talking. We have higher UIs than MUIs. That's a stat. We know that's happening. There's less training, less quality care. Low wages get what you pay for. Limited access to the community. Eric talks about loneliness and isolation. Revolving door for staff. You think about this for a moment. You ask every parent, what do they want for their child? They want consistency in their life. What's the first thing about consistency? That's the DSP. Think about it for a moment. This morning, when you got up, you probably did 30 or 40 things in the first hour of the day, and you never thought a thing about it. You got dressed, obviously showered, brushed your teeth, ate a meal, made your coffee, grabbed your car keys, and ran out the door. Every little thing you've done, if you were a person with a developmental disability, you'd have had a DSP next to you to support that. all those little items. We take things for granted each day. So put yourself, what we're trying to do this day is put yourself in the eyes and the ability for someone with a disability and what their life's about. Without the DSP, their life stops. So what's been done? Obviously, Director Martin's going to be there that day. He's going to speak around 12:15 in the afternoon. Obviously, Director Martin, he's raised Medicaid rates. We recognize that. We know we had 10 to 13 years without any increase in Medicaid rates. Director Martin has been a supporter of trying to get increased dollars in. We did the competency-based add-on this past year. That has helped. But obviously, it's not enough. Increased unity and collaboration across the field, we've seen that. I just talked about a county board association, superintendent association. Everyone you talked about is on the same page that something has to get done. Medicaid expansion has happened. DSP Ohio, Opera is supporting a DSP Ohio recruitment campaign across Ohio. CP3O from Opera as well. Increased professional development recognitions, DSP PAS. We're trying to do everything we can to support the individual with the DSP, make them feel obviously that they're valued and we understand what they're doing. But quite frankly, most DSPs, when you talk to them, they don't think we're doing anything because they don't see it. They don't see a collective effort saying, what are we doing? So again, I'm going to go back on the campaign in September 27th. It gives you a chance to show your DSPs that you care, that this matters, and it tells the state legislator that we've got to do something to change the course of action in which we're going. Nationwide, we also, I should say, this is Ohio, but we've been pushing this out nationwide. Anchor will be pushing this out right after the DSP Appreciation Week next week. Anchor is going to release a nationwide campaign about the same thing, Bridge to Equality, and trying to, on September 27th, that day, try to do something to help support individuals with developmental disabilities. Sorry, I'm trying to catch up. Obviously, our focus is on the individuals. That day, we will have individuals speaking themselves. We're going to have parents and family members speaking. We have a representative from the County Board Association speaking. Director Martin will be speaking. So really, it's about the individual, okay? We're focusing on the outcome, their negative outcome because of the lack of DSPs. We want to make, obviously, people in Ohio aware of this, of the deficit and the problems we face. We still believe there are many people walking the streets in Ohio that have no clue that these jobs exist. You all see, understand, I've said this before. You can go down the street and you see a hospital, you see a nursing home, you see an assisted care center. Immediately you think, hey, there's a job there. Back in the early 80s, we did a great thing. We pulled all the signage and we put people into the communities. We integrated into the communities across Ohio. People with developmental disabilities should be in our communities. But the reality is they disappeared in our communities as well. They're in group homes all across Ohio. That's a great thing, but we don't see them. We know for a fact there's people living in neighborhoods that don't even realize the group home's 2 houses down. There are jobs in our neighborhoods. We have to talk about that, and we've got to get more people going to this field. So, again, it's a focus on the individual, it's the rights and unity, awareness of the conversation. As said, we're not that day demanding higher wages. That day is more about the individuals themselves and what they need and what we should be trying to do to recruit awareness program. We know the fact is the first step is to develop the awareness and get it out there. We know what's going to follow immediately thereafter. We are going to go to state legislation and ask for some federal dollars, ask for some increased rates, because we want to make people aware of how severe this problem really is. Finally, you know, I know I'm kind of going through this quick. Finally, we can send this out, correct, to everybody here? We can go through all this, obviously send this out. I strongly, strongly recommend. My pitch basically is this. If you care about your DSPs, this system's in crisis. It's about to crumble. We know that. People who are working every day in the weeds feel it and know it. Go to these locations, look at it, do something about it individually. Get your memberships, your agencies around this day. Show up. We want to pack the plaza at the State House on September 27th. if we all unify together, the best thing we can do is show that rally that day that this is a serious problem. State legislators cannot deny the fact if we have that plaza just packed to the gills for this need. So I'm asking to be there to help support the event. Any questions? Yeah.
So, I'm not fully clear on what we would be doing about demanding the higher rates. I know I'm an agency owner, so a higher rate would be great for me, but just because I'm playing delicate advocate, just because I pay my DSPs more money, that means that I'm gonna get a better outcome from them in the way they provide services and decrease the turnover. So, that day, or when the day comes, would it be, I just want to put out there, to maybe ask, I don't know, some kind of training. You know, I think agencies, sometimes we have a big disconnect on being able to, a small agency at that, to support people to have a lot of training, the amount of training that they would need to be out in someone's home, because you can't make someone empathetic. And so,
I get it.
as an agency owner,
Sure.
I see that
We know wages matter. And the second thing is, because we have such high turnover, your problem with training is impacted greatly. You train somebody, a week later, a month later, they're gone. What do? You have to retrain again. You're never out of that cycle. And again, the consequences and the suffrage is really related to the individual themselves because of that constant turnover. So training's a big issue. Obviously, yes, you can't make people care for individuals. But I do believe the starting point is wages and funding, and you've got to make it a value. When McDonald's can pay $11 in Mason, Ohio to walk through the drive-through, you got a problem. And people need to understand that. You know, we're not flipping hamburgers, we're taking care of people. So, I don't know if we got a minute just to show a quick video. If we don't, I know we're really late, but
If it works, then
is it dead? Okay, forget it.
Yeah.
We can share the video out through this
We'll
process as
definitely
well.
send it
So,
out, yeah.
all right, thanks for your support, guys.
All right, thank you, Mark, for your passion, and thanks for that point, too. You know, it really is a complex issue, multifaceted, so multi-pronged approach. Also, you might want to consider North Star, because that's a training, a package that might be useful for your, and I can talk to you afterwards about that, for your staff. I wanted to round this discussion out with a resource that we are going to be providing locally, and we were inspired by another county. Lucas County has done a lot of work around trying to support providers with DSP concerns. And one of the things that we've learned from them is they have something called a success coach. And that's a role where a point person could be there to provide connections in the community. So if you have a DSP that is really struggling with car issues or food issues or housing issues or daycare, those kind of really basic things that would prevent them from providing good support to people in their homes and in the community, that they have a person to call. So we are going to do a pilot here in Hamilton County, and we're calling it the Resource Allies Project. It's short term because we want to demonstrate to ourselves that this might be a possibility. So before we further invest, and we have a staff person who will be able to do this, to be our point person. Eric, do you mind if I just cover this? Do you want to say anything about it? Okay. So we have the gold standard providers are going to be participating, and then if you are interested, we have that's about 10 providers. If you are interested in this project, let Eric or I know, and we'll take the first 10 folks that are interested in doing this. And so this point person would, all you have to do is call or email her, your staff. So you would tell staff, we'll explain it when you sign up further, but tell staff this is a person and managers that could be a point person if you're experiencing any type of resource crisis. We're going to see how it works. We're going to track the types of requests we get, the volume, and see if it's something that might be useful expanding in Hamilton County. So does that make sense? We'll have a point person on our staff for the next 6 months, so short term, to kind of track those types of support needs. So if you are interested in this, contact Eric or I, and we'll take the first 10 providers that are interested in joining us. And you too, whoever's looking online. So, okay? And we'll also post this flyer so you can see what we're talking about. Okay, so we have a couple, I know this has been a long session, but a couple quick things coming up too. So we have, Jenny's gonna give us some MUI updates, and then Karen's gonna do a couple of additional updates. You wanna come over here? I know.
All right. Hopefully you can hear me. Can you hear me? No, maybe. Hold it up, she says, at an angle. Okay. So real quick, this kind of piggybacks on what everyone's been talking about, Mark, Dawn. I just wanted to touch base. Again, we're seeing the shortage of staff impact MUIs. We're seeing a lot of neglects, and a lot of them are systemic in nature, and we recognize that. And I hope that you are able to see we're really trying to work with you. When we have that systemic neglect, obviously, our recommendation usually is we pull staff, right? We're not recommending that if the person's health and welfare is not immediately at risk. So we do recognize that, and we're trying to work with you. However, when we have the bonehead move where the person purposefully or blatantly neglects somebody, we don't have a choice but to recommend removal. So having said that, I really just wanted to touch on levels of supervision. We really need to start there. If we can clarify those levels of supervision and we can make sure that we're not setting staff up to fail and we're not setting the individual up to fail, then I think that's half the battle. And so I just want to, when you're receiving those plans or when you're sitting in those meetings, ask yourself, does it make sense? Is it doable? If I was providing the service, could I do this? Does it make sense to me? We review plans all the time, and if we can't understand what the level of supervision is, then how do we expect our direct care staff to understand what the level of supervision is? So some of the things just quickly that we've seen literally in the last week, someone has alone time for 60 to 90 minutes, but they're constant auditory. So what does that mean, right? To me, common sense would say I have to be able to hear them at all times. I can step outside the apartment, leave the door open. To someone else, to a direct care staff, that meant I can go out to my car and sit for 60 to 90 minutes. So again, it's a lot of it is interpretation. Can someone be close, constant visual? Close, constant visual if I'm one staff and I'm responsible for 3 people. You can't do it. It's not possible. It's not feasible. The other one was having a one-on-one, having someone in a home with 7 other individuals, 2 staff, one of whom is a one-on-one staff, and another person requires a 2-person transfer. It can't work. It can't work. And we recognize, the excuse is we don't have the staff. We're borrowing staff from other homes. We asked an individual to watch this person while the 2 staff went. And, people are really struggling, and we recognize that. So again, make sure it makes sense. One of the other things that we're seeing a lot of recently is home versus community levels of supervision. We've done a great job at breaking that down, right? Home, community, day program, transportation. But what we lose now is when someone leaves their home, as soon as someone steps out that front door, unless it's otherwise stated in their plan, that's community, okay? If you have access to the community, that's community. So if I walk out my front door, and I have access to people walking down the street, or I walk out into the hallway of my apartment building, technically we're seeing that as community unless it's stated in the plan. There's lots of people who can go out and sit on their front porch or go in the backyard, or they can do whatever, but we want to make sure that that's specified. Again, we just recently had one where someone had, they were able to go outside and sit on the porch. We have people approaching people on the porches now. So we need to be aware, we need to make sure that those things are, addressed and considered. So again, make sure that, it's clarified in the plan and that staff understand. Yes, they can go outside and smoke, but I need to do 1 to 2 minute checks, or I need to keep the door open so I can see them, or whatever the case may be. And then finally with supervision, remote monitoring is huge right now, right? We're seeing lots of remote monitoring. I think that it's the wave of the future, and I think it's a great thing. But we need to have checks and balances in place. So much the same as if my shift ends at 7 a.m., remote monitoring ends at 7 a.m., we need to make sure that the 7 a.m. staff person who's there to relieve remote monitoring is really there. We're seeing lots of times remote monitoring ends at 7 a.m., but the 7 a.m. staff person just doesn't show up for their shift. And then we have an individual left alone from, 7 a.m. to 3 p.m. when the 3 p.m. staff comes in and realizes that, they never showed up. Yes.
So what happens if there's like a blackout, my monitor goes off, like how does that work?
That's a whole separate, some of the agencies have the remote monitor on site. I don't know if there's backup systems. We have not. I'm sorry?
So backup systems are required by rule.
Backup systems are required by rule. So there's a backup system in place. We have not experienced the mass power outage, and hopefully we never do. But yeah, I do know that, there are times where cameras have been covered up or sensors have been covered up, and the remote monitor is able to address that. So it's kind of along the same lines. So again, that's kind of my point. Make sure there's a backup plan in place. Make sure that, what are we going to do if staff no calls, no shows? A lot of times we have kind of stretched it a little bit, and remote monitor has stayed on, and we're able to kind of, keep the person safe, or we're making phone calls, or we're doing whatever in the interim. So we're not having to file those neglects. Still an administrative issue. We still need it to be addressed, obviously, with the staff person, but again, trying not to, jump to automatically removing the staff and creating more issues. And then finally, I just kind of wanted, again, something else that we've seen that kind of goes in line with neglects, but again, making sure that you understand when you're doing the My Plan what the support needed means, like on the assessment. So we've seen a lot of issues recently with full assistance versus partial assistance, and that means different things to different people. Unfortunately, we had a pretty significant incident where the person according to the plan, needed full assistance in the bathroom. They suffered a medical emergency and passed away. And then when we started interviewing staff, they're like, well, full assistance just means that we have to go in afterwards and help with wiping. Okay, well, that to me is not full assistance. Full assistance is I'm there, I need to, assist with maybe transfers or pulling pants up, pulling pants down, whatever the case may be. So again, making sure that we understand what it is so that we can make sure that our staff understand what it is so that we're not seeing, these neglect situations or setting staff up to fail. Because Lord knows we need our staff. So, and then finally, the last thing that I have is I just wanted to invite anybody who's interested to the last semi-annual analysis. They're doing away with those in new rule, which was supposed to come out by now, and I wasn't supposed to have to do this. But they've, of course, postponed the new rule coming out, so I have to do one more. So it will be September 21st, 10:30 a.m. at the support center in the large conference room. So I'll send out for whoever's on my email list if you guys are interested in coming. If you're not on the email list and you're interested in coming, let me know, because I will gladly add you. All right, thanks.
Hi, I'm Karen Sherman, and I manage the provider compliance area and quality department. I wanted to mention a few things. First, the self-waiver is going through an amendment with some updates, and those are projected to go into effect September 23rd. For the most part, they deal with services we don't authorize a whole lot, like the stability assistance. The main changes we are seeing is with the participant-directed goods and services, where there's additional guidelines for what can be authorized and processed for high-ticket items to go through a second review process at DODD. So quickly, because I know we're over time, I wanted to talk additionally about the provider validation process that we are doing through our provider search page, just to make sure. We've gotten a lot of feedbacks from individuals, SSAs, family members that they love our provider search, but sometimes the data is outdated, which makes it frustrating to use. So what we've been doing the past year is validating data on the provider search. So annually, providers will get a call saying, hey, this is what we have as your contact information. Is that correct? And we reach out multiple times just in case we don't get a first response. So shortly this fall, we are going to start publicizing that data. So the provider search will have an area where it can show people looking for a provider. Yes, this data has been updated in the past 12 months, so it should be more accurate. The provider's engaged. That being said, if you ever at any point know that your data is outdated, you can always email provider support at hamiltondds.org. No dots, no spaces, and provider support.
Can you say it again, Karen?
Provider support at hamiltondds.org.
All right, thanks, Karen. And we will be having a way to indicate on there that whether something's been validated or not. So I think it'll probably be a big V that says validated. So, it really is, pay attention and remember that you should be getting a call. And if you check your own site, check your own information regularly just to make sure that it's correct too. So we really want this to be a partnership around that. So anyway, it's thanks for being here. I hope the traffic is much better on your way out. Anybody that's watching online, please give us feedback on how we did so we can make improvements. Thanks, everybody. Bye-bye.
This is a model. See the video on